Better sleep, sharper focus, a healthier life. It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise,
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started.
So, I get the pleasure of interviewing and chatting with one of my dear friends and my own personal pelvic floor PT. This is Dr. Lauryn Beecher. She is amazing. But we started talking about how while we work on different ends of the body, we have so much overlap. And now she's becoming a patient of Untethered, and she's starting to notice the overlap from her perspective. And so who would have thought that talking about oral restrictions, tethered oral tissues, tongue ties, lip ties, cheek ties, would also correlate with pelvic floor health? And so that's what we want to dive into today, because the body's going to body. It doesn't know what it's going to be dealing with. And so many of our patients and so many of your patients want to get to the root cause of symptoms to manage their overall health better. So what do we need to know? So Dr. Lauryn Beecher, without further ado, I would love for you to introduce yourself. So you are a pelvic floor PT. For those of our listeners that don't know, that is a specialty. And everybody has a pelvic floor. My husband likes to say he doesn't have one, but of course he does. Tell us what that is and how you landed in such a niche part of physical therapy.
I really started my career in pelvic health, which is, say, a little bit unusual. Oftentimes people make their way to pelvic health after having a baby because they feel so unsupported and like nobody told them all of these different things were going to happen.
Unsupported physically in their own body and unsupported with like professional help.
Yes.
Yeah, okay.
And they're just left to figure it out themselves, which in its own way was my entry point. I had always nannied and babysat. And
so you're watching moms like kind of firsthand go through this postpartum phase.
And so many of the moms that I nannied for, both in college and then while I was in PT school, they had pelvic floor issues. And they were told by their well-intentioned provider, well, just wait until you're done having kids.
Sure.
And then we'll do surgery. And there was no one saying to them something like physical therapy could help them stop peeing their pants, not feel like something was falling out of their body. So they were left to just struggle.
Well, we've kind of accepted that as normal, right? Postpartum.
Especially as women.
I remember going to a woman-only workout class, and if we weren't peeing our pants, we weren't working hard enough. It was just so accepted that that was part of motherhood, was just peeing your pants. But there's also a benefit to, and I promise we're going to get into the connection between oral ties and the pelvic floor, but this was such a new journey for me as a patient that I actually started seeing pelvic floor PT while pregnant, before I gave birth.
It's amazing.
And I didn't go into it being like this A+ student. I was going in because I was having such significant hip pain. And I didn't realize the connections and how important it was, not only for my hip pain, but also in preparation for having babies, correct? Tell us about that connection and why pelvic floor PT is preventive, even if you're not suffering from a problem, either postpartum or pain.
And I think that's such a good example where honestly we have so much to learn from dentists, where with your dentist, you go in every 6 months, clockwork to stay on top of things.
The good patients do.
Good patients do. Finally, that's happening in pregnancy and pelvic health, where people want to be more informed. They want to understand what's happening in their body. They realize, oh, I just sneezed and I peed and I didn't like that. And I don't want to be like my mom or my grandma. So how can I be preventative and work on this now and learn to connect with my pelvic floor so that things like pushing go much smoother And those aches and pains that we've just accepted as normal in pregnancy, they don't pop up, or they certainly
Well,
don't
it's hard.
become debilitating.
There's so much physical toll put on the body during pregnancy. What can we manage? What can we control? And of course, everything's so multifactorial. It doesn't mean it's going to be a magic bullet, but what can we help? So pelvic floor PT during my first pregnancy, kept on learning throughout my life. By the time I had my third baby, I started to connect pelvic floor relaxation and breathing. And still, I wasn't connecting it to my own professional life. I was connecting it to my own body. But that was fascinating as well, that so much of even the labor and delivery, and I've heard you talk about it with pooping, is not an active push. It's just relaxation and peeing. So any of you that don't know the anatomy of the pelvic floor, Lauryn has in her office this incredible three-dimensional model. And it just shows how the torso, I'm going to say all the all the anatomical words wrong, but for a layperson, my own vocabulary is like the torso and the abdomen and the limbs, the legs, everything kind of converges at this pelvic floor. And we think of the word pelvis and we think of going to the bathroom and having babies, but so much is going on to other function, like movement function and walking and jumping and running. So when I saw that anatomical model, all these light bulbs are going off of like, oh, no wonder I have pain in my hip or X, Y, and Z. So if you're listening to this, when you're not driving or you have the access to your browser, go look up the image, the anatomical image of the pelvic floor and see all the connections.
And I think so often people think it's just this little area or just this one muscle.
Sure, like
And we
like
have-
just like the perineum, right? Is that how you say it? Perineum?
Yep, perineum.
Perineum, like the part between the holes.
Right.
That's what I thought it was. It's the entire bottom half of your body.
All of it. And it's this huge sling of muscles that travels from the front of the pelvis, the pubic bone, all the way back to the tailbone, and then it connects them to sit bone or to butt bone. So it's this sling or this hammock for all of your organs, your bladder, your uterus, or if you're a man, prostate, rectum. And we need that base of support to not only be strong, but nice and mobile. So when we talk about like pregnancy and birth prep, that's a huge part of what we're working on. And we're often connecting it to, can you release your jaw?
Okay.
Can you soften your jaw? Can we use those like low pitches and low sounds? Because if your jaw is relaxed, your pelvic floor can relax.
So one of the things I've paid attention to over the last several years, and you guys can do this while you're listening, is I'll be quiet for a second and pay attention to your body. Where do you feel tension? And I noticed when I started to create this awareness, it was in my jaw and it was like a clench in my stomach and my butt. I'm just walking around clenching everything.
You're a butt clencher.
And when I started to realize that, only when I realized that could I soften and relax. And that kind of ties back to the postpartum peeing your pants, is we were taught to kind of keep tightening, keep doing your Kegel exercises. And while that's important for some patients, for a lot of us, it was that we were already too tight. We needed to relax, correct?
I literally just had that conversation. I was at an event earlier today, and a woman walked up to our table and we're giving away, some little things. And she's like, so I've heard that sometimes you pee your pants because things are too tight. Like, yes, exactly. I'd say 90% of the people that we work with who are quote unquote peeing their pants, their pelvic floor is too tight. They're holding on too tightly. And sometimes it's a stress response. Sometimes they don't have the strength in their core and in their hips that they really need. But one way or another, they're just holding on too much. And then they sneeze, they cough, they laugh, they jump, and their pelvic floor just can't do any more because it's so tightly wound already.
So once you're holding, you can't hold harder, basically.
Exactly.
That's so interesting and so different than how I ever envisioned it. So you're talking about the jaw. We carry a lot of tension here. We need to soften, relax, paying attention to how we're carrying our stress. So wherever you are right now, where you're holding tension, breathe through it, let go. Walk us further down the chain, the connection to the jaw and to the breath.
Another image that can be really helpful to look up is the deep fascial or deep frontal plane. And it's this connective tissue that runs all the way from the jaw down the throat to the respiratory diaphragm, that big breathing muscle.
I pause there because
underneath
the
the ribs.
anterior part of that is actually under the tongue. So when we think of fascia, picture the white gauzy stuff that you peel off of an orange. When you're peeling an orange, you've got to peel off that extra white connective tissue. That's fascia. Or for those of you that cook and eat meat, if you're peeling the white gauzy stuff off of a chicken breast, that's fascia. So we have fascia in our body that's holding muscles together or holding muscles
surrounding the muscle.
Okay.
And it runs
We used to think it was very
muscle to ligament. It's connecting all the soft tissue.
And we used to think it was very disorganized, right? Kind of like haphazardly around the body. And now we understand that it is very organized. And so what you're referencing is this one plane of white gauzy material that starts under the tongue, the very tip of the tongue underneath, goes down through our jaw. And I keep going. So then I interrupted you, but I wanted to connect that part of it.
No, that's perfect. So it's traveling, like you said, from the bottom of the mouth, the tongue, all the way down the throat to the respiratory diaphragm, our big breathing muscle underneath the rib cage. And then it continues to travel down into the pelvic floor. So if you think of those openings where you pee and you poop, that's your pelvic floor.
So the fascia is interwound all around those muscles.
And then it continues to travel down the legs all the way into the arch of the foot. So when we're working with someone and thinking full body, I like to use jumping as an example. You're working out, you're doing jumping jacks, you're breathing deeper, maybe heavier, you're bouncing. So that load needs to be absorbed in your feet and your knees and your hips. It needs to move throughout your body so you can keep jumping and keep moving. But if at any point, maybe your jaw is held too tight, or you aren't taking a full breath, or your pelvic floor is clenched, or you have, a lot of tightness in your foot and ankle, that load, it's not transferring well. And that's where we can get issues like peeing your pants when you jump.
So one of the best images I've seen, so I know that most people are listening and they can't see audio. For those of you that can see my hand movements, that might help. But even better, I'll put a link in the show notes to a video that I saw if I can find it. It was basically showing what fascia is. Like if you pull on one part of fascia, like a picture, like a really taut spider web, it's going to pull everything. So you can't pull on one part of it without it impacting another part. And that was a very clear connector for me of like, okay, if it's tight here, it's going to pull up the whole chain. And where I think that that's really fascinating is, yes, there's tightness in muscles, but there's also fascial tightness, anatomical differences like ankylosing or tethered oral tissues or a tongue tie. So if you were born with a lingual frenum, which is fascia, it's submucosal, it's underneath the skin or underneath the tissue, like the pink tissue in your mouth. If that fascia is too short lingual frenum, ankylosing, or tongue tie, you are going to learn how to use your muscles in order to survive. Humans are amazing adapters. You're going to get by with compensations. You're going to start to use other muscles, but it's going to pull on that fascial chain, which is going to cause not only muscle tightness from adaptations and compensatory muscle usage, but that fascial tension is going to pull everything up. So one of the things that was eye-opening to me is I'm treating tongue ties in our practice to help idealize muscle function, decrease compensatory muscle use in the face to help decrease jaw pain, facial pain, or in a growing patient, help them grow better. But one of the things that patients were telling me in the chair during surgery or immediately post-operatively is, I feel this huge relaxation in my shoulders. I'll watch them during the surgery have their shoulders roll back. I had one patient, he was a mid-20s guy. I have to find the video of it because I started recording him because it was such a cool story. He's like, I have had tension in my left quadricep muscle my entire life. I've been in and out of PT, and it's just this kind of chronic tonicity. Like it's just really tight. Mid-surgery, he said it relaxed for the very first time. And I'm not touching the leg.
No.
We're touching something that's holding on to everything else. That's holding everything else up as well.
Well, I know I'm so curious to, as I continue my journey, I similarly hold all of my tension in my upper traps, jaw. Just this week, I saw a physical therapist who does a lot of dry needling, and she's dry needling my temporalis and my lateral pterygoids and masseter and
you have a tongue
upper
tie.
traps. And yes, I intentionally had this visit with her this week leading up to getting my expanders put in this upcoming week. I just want everything to be as like relaxed as possible going in. But I told her, I'm like, I am so curious to see over the next 12, 18 months as we're working on the structural side of things, can my upper traps relax at any point? And I'm sure they will. And I'm just so curious to see how does that feel in my body once that structure piece changes.
100%. Yeah. And I think about our conversations with our friend Lauren, who's a chiropractor. She's told me that while patients come in frequently for their adjustments, if they have a chronic issue, they'll have an adjustment. And you probably see it with PT as well. It feels better, it's relaxed, it's adjusted, and it comes right back. And she's noticed that after patients have their restriction addressed, their tongue tie release, they hold their adjustments better. So kind of like what you're saying with your own body, as you go through this process, you're going to have an amazing awareness. We'll have to have another episode mid and post treatment to see how you're feeling.
No, I'm so curious. And even when you were just a couple moments ago speaking about the function piece, how we are going to survive, and doing myofunctional therapy and learning how to use the muscles in my mouth, and we've built up some strength, so we're getting into the function.
So kind of unlearning all that compensatory wrong muscle usage you've been doing your whole life to get by, right?
Yes. And this week we practiced how my tongue should move when I swallow. And thankfully it was just water, because the first time I swallowed, I spit it out of my mouth. And it was like, oh, nope. Okay, let's try that again. And I've swallowed who knows how many billions of
2,000 times a day
in the course of my lifetime, and I've never done it with the structure that I needed. So the function, my body figured it out.
So then you think about, okay, great, good job, body, right?
Thank you for keeping me alive.
2,000 times a day for however many years old you are. Think about that compensatory fatigue that it's causing on muscles that are not supposed to have to work, right? So it's amazing that we all aren't walking around with chronic pain and functional issues.
Well, and I think to that point,
I guess we are.
so many people are, and they're walking around and they don't know how good they can feel. I say that's something we very commonly hear in pelvic floor therapy. When someone's hip pain that has bothered them for the last decade, or their back pain, or even sometimes tension headaches. I didn't know that my head could feel so light, or I didn't know my back could move this well. And sometimes there are, true bony structure things that we as PTs aren't going to change. But if that's not it, how do we improve the muscle function, build the strength, build the mobility so someone can feel really, really good, but they've just been living with it?
They don't know it will be better.
They're normal.
They don't know how to complain about it. Exactly. We hear the same kind of thing with breathing, especially in expansion. And I'm so excited to see if you notice this, is not even at the end of expansion, but when the suture, or where the two bones at the roof of the mouth or the floor of the nose open, when we expand that, as soon as that releases, a lot of patients actually notice a decrease in nasal resistance. They have an easier time breathing. Some people don't notice it that profoundly, and a lot of people do. So it's going to be interesting to see what you notice. But we'll hear that same kind of thing of, I didn't know that I was having such a hard time breathing until I took an uninhibited breath for the very first time. And that's so cool.
It's so cool, and it's so powerful. And I think that's one of the really special things about the work that we do. It's people, they're surviving, they're getting through, but we're able to help them feel so much better and so much more comfortable in their bodies. And it's just such a gift to be able to work with people in that way.
It's such a gift. The fact that they trust us and that we get to have the reward of having people say, I feel better for the first time. Yes. How wonderful, because they want to be seen by us. That's really cool.
And it makes me think of another woman that I worked with who, she's a complex enough medical history, but she was coming in primarily for pain with sex. And one of the things that she incorporated as we were working together was getting her oral tethers addressed. Seeing her after that, this is the first time it feels like your pelvic floor has let go in your entire life. We were doing soft tissue work, we're getting things
you
moving
could feel a difference.
Could feel a huge difference.
Just softer, less tight.
Yes.
Could she feel a difference?
She could.
That's amazing.
And it was so cool. And for her, that was the missing piece. No amount of us doing manual therapy was going to get her to the point where her pelvic floor could fully relax.
You just gave me a great marketing idea.
Have better sex.
Have better sex. Treat your tongue tie release. Yes.
I think there's a whole market for that.
I think we're going to go down that route. You think about the stress, the low level stress, or even high level stress, but the low level chronic stress that we're carrying in pain or in tightness and compensations or using the wrong muscles. and we don't even know it. And you think about the energy output that could be regained, like that energy could come back to be given to you for rest or however you want to spend that energy. I think about energy in and energy out, and like we're just giving it away to systems that are working too hard.
Well, this was having an impact on her intimate relationships, and she'd spent who knows how much both like time and financial resources trying to address it. But until we got those different pieces in place and had them all working together, she wasn't able to make that full progress and fully live her life.
We say a lot of the same things, right? There can be so many pieces to these very complex puzzles of human beings and so many different things that we can throw at problems.
Mhm.
But if the structure and function aren't addressed, no matter how many other therapies, modalities, supplements, toys, tricks, tools, band-aid solutions you try, you're never going to be all the way better.
Yes.
And so one of the things I'll say to patients all the time when it comes to breathing is if we're looking at a health history or a checklist of things that could be red flags for dysfunctional breathing, if you check enough boxes, the responsible thing to do is uncover if dysfunctional breathing is part of the issue. Either uncover it and address it, or rule it out as part of your multifactorial puzzle. Because if it's not part of your puzzle, great, we don't have to deal with it. But if it is, all these other pieces aren't going to give you as much relief without this cornerstone. And that's the same for you too, I'm sure.
I tell people, especially in pregnancy, when they're like, well, my friend said I should do this pelvic floor therapy thing, but I'm not having any problems. Great. So worst thing that happens is you come in and I say, you've got great mobility, you have great control over your muscles. When your brain or when you tell your muscles to do something, they do what you want. Your hips are
We've
strong.
ruled it out.
Your core is strong. You're in a great place. Here are some ways that we can keep you there. If that's worst case scenario, is
That's awesome.
we only have a little bit to add in.
That's such a great point. I love that approach of like, okay, that's the worst case scenario, great. And if it's the worst case scenario, we actually find issues, celebrate it. We found something we can work on. We found something that we can tip the needle on to get you closer to comfort, health, easier path forward, whatever that path is that you're working on.
Exactly.
You've heard us
I
talk
love this.
about how airway health impacts everything from sleep and behavior to feeding, facial development, and overall systemic wellness. Now we've created courses to help you take the next step. Whether you're a dentist ready to transform your practice or you're an allied provider wanting to deepen your airway expertise, the Untethered Way has education designed for you. Our Foundations of Airway Dentistry course gives you the complete clinical and business framework to integrate airway-focused care into your practice. You'll learn diagnostics, treatment sequencing, case presentation, and the systems that help you build a sustainable, thriving practice while offering life-changing treatment. We've also made this course available to allied professionals, and we're blown away by how many IBCLCs, speech therapists, orofacial myofunctional therapists, dental hygienists, and even physical therapists and occupational therapists have asked for this training. We also offer advanced surgical training on frenectomy protocols across all ages, infants, children, and adults. The training is available online as well as live intensive courses with hands-on learning. These are the courses that we wish we would have had access to when we were first learning about airway dentistry. They help you condense time into helping changing lives and change the financial health of your practice. You can learn more and enroll now at theuntetheredway.com. The link is in our show notes.
So we've talked about pregnancy and why a pregnant woman or a postpartum woman would come in to see a pelvic floor PT. You kind of hinted at why a man might come in, prostate issues, incontinence issues, pain issues. What about kids? Because I know your practice also sees children. Why would a child come and see a pelvic floor physical therapist?
Yeah, so one of the really cool things about our practice is that we do work with all ages, all genders, which is very unique. And the kids that we work with, it's so fun because we're not only helping that child's life, but we're at the end of the day, we're impacting the whole family. Because kids that come in to work with us, most often it's constipation.
Okay.
These are kids who they're withholding or they're having so much pain with bowel movements. They are either refusing to go, their rectum has literally gotten so stretched out, they don't feel an urge to go anymore, which can get to the point then that they're having poop accidents. So that's sadly one of the most common reasons why families come in, is somewhere along the way they got constipated for a whole variety of reasons, and now they're having poop accidents. When things aren't going well with the bowels, the bladder tends to act up as well. So they might be struggling with bedwetting, and these are kids who are well past the age of 4 or 5, where some nighttime accidents are still
Age appropriate.
age appropriate, especially if, oops, my fault, I let you drink fluids way too close to bedtime.
Sure.
That was my bad. So bedwetting, they're laughing, they're playing on the playground, and all of a sudden their underwear is wet. Or gymnasts, dancers who they're landing and their body isn't able to take that load, and they're peeing every time they land.
So they're coming in to see you. I would imagine that there's some similarity with this misconception with women postpartum, just be tighter, right? So if they're having poop accidents, they probably think they have to come in with a strength mentality, but really it's totally resetting the system and having an awareness there. One of the things I would love to dive deeper into is there are so many causes for constipation, and that's not
So many.
necessarily your role, and it's certainly not my role, but I know that with oral facial myofunctional disorders, we're chewing in a way that doesn't allow us to control the bolus of food, just like you spit out the water the other day. And so maybe the kid or adult, but in this case, talking about the pediatric population, the kids are eating with their mouth open. They're chomping their food. They're not controlling the food into a nice small bolus of food to swallow. They're kind of mushing it all back. These patients overlap with us because they have food packed all over their mouth. They have a higher cavity incidence. They have myofunctional issues. They probably have a tongue tie. They probably have breathing issues. Another reason why we see picky eating is if you can't breathe through your nose, you're going to choose foods that's very easy to eat quickly so that you can go back to mouth breathing. I bring this up in this conversation because those are the things that also can lead to aerophagia, taking in too much air, or a picky diet and not having the right kind of nutrients. All of these things can now overlap on a Venn diagram with constipation. And so it's fascinating. We're not going to go straight to my role of helping. For dental practitioners listening, think about these kind of questions in your health history and start to wonder if they're having incontinence issues and enuresis. Could there be some sort of overlap on what we're seeing and what you would be seeing?
And I think that's just it. There is quite often an overlap, and that's where I think any and all healthcare professionals, movement professionals, anybody that has an intake form, it is very easy to ask about bladder and bowel habits. How often are you peeing? Do you have full control of your bladder? How often are you pooping? Do you feel like you empty all the way? 4 very easy questions that you, depending on your role, may or may not feel comfortable asking that person.
But we could maybe ask it in a way that gets the same information. Are you a picky eater? Do you avoid certain foods? Is it hard to swallow? Is it hard to clear your mouth? Those are things that we as dentists could ask that would maybe get us some of the same information.
Exactly. And then it clues you into, okay, I'm going to help with the structure and function in the mouth and face. If that's not enough to help with the function of everything with digestion, including things like bloating, just digestive upset, motility. One thing that we talk about with everybody that we're working with who has any type of bowel issue is how are they eating? And talking about how digestion starts with smelling, tasting, and chewing your food. So are we actually chewing? Are we just wolfing it down?
Keep zooming out. Keep zooming all the way out. What do we have access to evaluating and changing?
Exactly. I can ask about, tell me more about when you eat. Are you actually chewing? Those kinds of things that then clues me into, okay, if they can't just consciously slow down when they're eating and that doesn't solve the digestion part that we're working on, how do I loop in another person who can ask those more specialized questions?
That's so cool. We're really getting into the weeds on how much overlap there is, but just the connection of how the body function to me is so fascinating. And yet we're trained in such fragmented, compartmentalized ways, right? Our specialties are determined by where we are, and yet there's not enough connection or awareness of the whole body.
I think very early in my career, I intentionally took a PT continuing education course about TMJ pain. So I was having a lot of my pelvic floor therapy clients with pelvic pain were also having jaw pain. And the instructor like cracked a joke of like, oh, now you can treat both holes. I'm like, well, yes, because they are very connected.
It's the same tube.
Same tube.
Well, and
One
like
end to another.
another thing from your own personal journey and a connection again of the two holes, but with the breathing component in TMJ, right? So we know that we carry tension and tightness. We also know, we as in airway dentists and patients or and providers that understand the connection to breathing, is the number one reason that we clench and grind is an airway issue. So if we can't breathe well, we will clench our teeth to stabilize our airway. And if there's any sort of resistance to airflow through our nose, even subclinically, we're unaware of it because that's how we breathe. We've never known any different. If there is resistance, whether we know it or not, it's going to create a vacuum pressure. And that vacuum pressure creates a collapsibility of the airway, which vacuums up acid, not from the gastro, but from the higher, the respiratory reflux. And that reflux, that acidic reflux, causes the body to brux or grind our teeth in order to produce saliva, which is basic, which buffers the acid. So unbeknownst to the person, the human, the body is doing all of this chemistry on its own, which is unbelievable to me. So the body is over there dealing with an acidic event. No worries, I got you. I'm going to clench to stabilize the airway. I'm going to grind to produce saliva to buffer that acid. And you're over here living with the complaints of your teeth are worn, your teeth are cracked, your teeth hurt, your jaw hurts. Your dentist is seeing more need for dental intervention because of the acid and the cavities and the cracks and the wear. And you're feeling stressed because when you can't breathe well, you're going into a sympathetic or fight or flight response. So you're connecting stress to the symptoms, and yet it's just the body's reaction to a chemical process. It's just so fascinating to me.
I always like to tell my clients, like, our bodies are so smart.
Our bodies are incredible.
They are going to figure it out. And what might be a short-term solution usually isn't the best long-term solution.
Well, I'm sure you hear this too, but like how many times your patients come in having had Botox for jaw pain, or they come into our office and they ask for Botox for jaw pain, that is going to shut down the muscles. That could temporarily relieve discomfort because the muscles can't clench anymore, right? That can feel so good. And how wonderful that we have Band-Aid solutions to help get people out of pain. But the question is, why are you clenching? Let's go further so that you don't need to keep spending the time and the money on this solution that's not really getting to the root cause.
And that's where I agree. There's this time and this place for a Band-Aid, or it can be a bridge that gives you the time, the capacity, that instant change where this feels better enough or better right now. But if we don't offer that option of, okay, I know this helps temporarily, but if we do X, Y, Z, then we can have more lasting relief here. And that's our responsibility to share with someone, and then it's up to them to decide.
Yeah, they might not want to. Maybe they love Band-Aid or bridges. That's fine. But we, as the providers, have this ability to give them a different option or a different path. I forgot to ask, I brought it up and I didn't finish the thought, but have you noticed a difference with your jaw tension wearing the nasal dilators and decreasing that nasal resistance? Have you noticed less clenching and grinding?
I have. A little background, I feel like I've always been someone who never wakes up refreshed. Whether I get 8 hours of sleep consistently, 9 hours, 6 hours, 10 hours, I have never in my entire life felt like I've woken up ready to tackle the day. And I remember the first night after I wore the nasal dilators, just waking up and I'm like, that's what it's like to sleep.
You don't know any different, right?
I didn't know any different. And I remember, I think I was planning to do a workout at home that morning. I'm like, I'm just gonna keep these on while I work out. I'm like, oh, this is what it's like to do some cardio and some strength training when you can breathe through your nose.
Totally.
I remember even as a kid, elementary school, running laps around the gym and the gym teacher saying, Lauren, breathe in through your nose and out through your mouth.
Yeah,
like, I can't, but I can't.
Yeah. I know our associate, Dr. Cook, Megan Cook wears her nasal dilators when she runs her marathons, and I'll go for a walk and I'll like physically hold my nose open. But you also were showing signs of clenching and grinding outside of jaw pain too. I know you said that you were having periodontal attachment loss and needing gingival grafting because of the clenching and grinding causing harm to the bony and gum structure too. So there's so many different ways that it presents, and patients might not have every single symptom. It might present in recession, or it might present in jaw pain, or it could be all of the above.
And for me, the recession, I think I remember texting you. I'm like, okay, Meggie, I just saw my dentist and what do you recommend for toothbrush, water pick. I'm making the investment in something nicer. And also, how do I get on your schedule? Because for me, it's like, well, I'm getting through with sleeping. I'm managing the jaw pain. I know when I get more stressed, I clench more. And I call my friend Anne and she needles my face and I get through. But that gum recession was my like, oh,
Well, and also if you go through with the procedure,
Mhm.
right? Like to have the gum grafting done, it will have a higher incidence of failure or needing to be repeated if you don't get to the root cause of it.
right. So that was my like, okay, it is well past time for me to address this. And thankfully, knowing you and knowing that, okay, I can reach out to Maggie and she'll get me set up and started so that I'm not in the position where my mom was probably a decade ago, needing gum grafts and needing bone grafts and all of these things. I'm like, I don't want that to be my future, and it doesn't have to be.
And everyone's going to have their own tipping point,
Mhm.
right? So we can see this, we can know this. And like you mentioned a minute ago, patients might be okay with a Band-Aid solution or a bridge solution or not doing anything at all because their pain point isn't a pain point for them. We see it, we recognize it, we've connected the dots, but if there's no value to them, it's not their time. Where I've had patients and family members that I've been talking about this forever with, and something will be the thing that causes them to want to do something. Maybe it's failure of dentistry and I don't want to keep doing dentistry, or their bed partner no longer shares a bed with them. There's going to be a pain point that's going to be the value add.
And we see the exact same thing in pelvic floor therapy.
Mm-hmm.
You know, someone comes in and they're like, well, it's not that bad. And maybe they're not ready to, do a care plan at that time. And then, or it's been something they've been thinking about for a long time and they've just never reached out. And then they're racing down the airport one day trying to hold their luggage and their toddler and they pee their pants trying to catch their flight. And then that's like
now
the
I'm ready. Now I'm ready.
Yes, or they're at the trampoline park, or they're with a new partner, or any of these things. It's that tipping point of I can't tolerate this anymore, and I'm ready to take that step to fully address it.
Well, how busy and stressful our lives are and how many things that we're juggling at all points, you can't have everything on fire. You can't be fixing everything. You can't be dealing with everything. And so when it's the priority, it becomes obvious. All right. So before we wrap up, I want to talk about what do we address first? So for listeners out there that are perhaps listeners like me that have pelvic floor issues and oral motor issues or restrictions, what do you do first? So we can help with making the mouth bigger and we can help with getting the muscles in the mouth to work the right way. We can get rid of restrictions and that patient has pelvic floor dysfunction. What do we do first? How do we decide where they should put their energy and efforts?
I think there has to be a combination approach. So, ideal world, we are starting with can we connect with the pelvic floor? Because I would rather someone have a little bit of a foundation that they're able to have some mind body awareness and connection to their pelvic floor. They're aware of any of the like lifestyle or behavioral things that are contributing to whatever their pelvic floor issue is. Because if they have that foundation, then when they start working on the function, the structure, they're set up for success better and sooner. And then we circle back with pelvic floor therapy once the structure is addressed to really fine tune things.
So create some awareness with some initial treatment and therapy. Take a break, get the structure optimized, whether that's creating a bigger oral cavity volume, making the floor of the nose wider for less nasal resistance, or getting rid of the oral ties so the muscles can move freely. Then coming back and fine tuning the PT part of it to make sure that we're now functioning optimally.
Exactly.
Okay. I can get behind that. I like that.
Then I feel like and we talk about this a lot at Pelvic Health and Wellness in particular, about how we are our client's guide. We're not there to fix them. We are there to be their guide, listen to their needs, their desires, and help them along that path. So by starting with, hey, here's what we know is going on with your body. Here's someone I can connect you with who can help with this structure piece that is way out of my wheelhouse. And then let's see between that foundation and that structural change, where are you at? How do we step back in to help you have that most successful outcome whatever that is for them.
Okay, I like that. So what does a first visit look like if they're coming in as a new patient? What can they expect?
First thing, we start with a conversation. So any of our new clients that come in, we have some paperwork that we ask them to fill out to give us a little bit of information about where we're starting, what might be most important to them. And we, recap anything they've already filled out. And then we get into more specifics about, so how's peeing going? What's happening with pooping? How is sexual function? What's your day-to-day? Do you have any movement practices? What does, basic nutrition look like? It's really, where are we starting? And then talking about where do we want to go?
So what the goals are.
Exactly. So sometimes I want to get through cold and flu season and not go through 4 pairs of underwear a day. Sometimes it's, well, I really want to run this marathon or go to burn boot camp and not pee my pants.
But it's not always about peeing pants either, right? So, for example, after I got through the hip pain when I was pregnant, the more I learned about it, my goal was I wanted to get through a natural labor and delivery with hoping not to tear. So, that was my goal.
And that's exactly what we would talk about day one.
Okay.
Seeing, okay, what are your goals and what is most important to you? Because that's what I want to make sure we start working towards first.
I love that.
And then we go from there. So we might start with seeing how the spine and the hips are moving. We might start with the pelvic floor directly. So there, I always like to tell people there are no stirrups. There's no paper sticking to your butt. There's no asking you to scooch where you feel like you're going to fall off the table. There are no speculums. Just scooch a little closer. We set our treatment table up. It's the same as a massage therapy.
I can vouch for that. Your rooms are very comfortable, cozy.
We use actual real sheets. And we're starting with a visual assessment. So when I'm talking to a client, I say, so first thing, we're going to take a look at your tissues, make sure everything looks healthy. And then we're going to see how are your brain and your body talking to each other. I'll ask you to take a couple of nice full breaths. And I'm looking to see, do I see movement at the pelvic floor as they breathe? And then I will ask someone to do a Kegel or try to squeeze. I might give them a couple other cues to see, can they find that squeeze and lift? All I want to see there is that when you tell your body what to do, can it do it? And same thing, I'll ask someone to gently push or bear down. Do you have that motor control, or is that something we'll be working on right away? And then we're gently feeling the muscles themselves, both on the and on the inside, to see, is there anything that feels tight or taut? I tell people, I'm like, if you feel anything more than that my finger is there and there's some gentle pressure, let me know. That's an area that we'll come back to and connect the dots to, okay, this is tight, this isn't moving well, here's why you're having pain, here's why you're peeing, here's why you can't poop, and bring all of those pieces together so that at the end of the session, it's like, okay, here's what's physically going on with your body, here's why this is happening, and here's where we're going to start. And we're going to keep peeling back those layers to find anything else that might be contributing. We're going to increase, the challenge and the demand on your body so that by the time we're either wrapping up care or we're moving more into a wellness, just keep you feeling good with anything that could pop up plan, you're feeling really great and you have lots of tools to keep feeling well.
So the goal is to get out of seeing you frequently, all the time,
Yes.
right? So maybe maintenance from here to there, but you're not hoping to keep somebody on your schedule forever and ever. You're hoping to get them back to a place of resolution and then maintenance.
Exactly.
I love that.
And we talk a lot about, I want you to have resilience. I want you to be able to get through cold and flu season and know, ooh, I need to pick that exercise back up, or I need to do XYZ to keep feeling really well, but you have enough buffer in your system where if you slack off at things a little bit at home, or life throws you a curveball and there's more stress, there's more physical demand, that your symptoms don't come back.
Sure.
Because if we stop where you're like, well, I got through the last week and I just keep using the pee my pants example. Well, that's great, but what about the next time you have food poisoning? Or
when you're really tested, how are you gonna do? Yeah.
So that's one thing that at Pelvic Health and Wellness, I want your symptoms gone and I want them gone for good.
I mean, I always go back to what I know, which is, I can relate this to myofunctional therapy. We will tell patients when you graduate, make an appointment in 6 to 12 months, or pay attention to when you start to notice those old ingrained muscle memory habits coming back because you've been doing things the wrong way for a really long time. It's natural to revert to that, especially when you're being really stressed or taxed. Then it's time to do a little boot camp or a little refresh. Yeah.
I forget where I heard it, but I heard the expression, our nervous systems are programmed for survival and not success.
But we want success.
We want success, not just survival.
I love chatting with you. Tell us where we can find you if they want to follow you and learn little bits and pieces along the way, or if they want to come and find you as a patient if they're in the Wisconsin area.
Yeah, so you can find us online. Both our Instagram handle and the website is Pelvic Health and Wellness, all spelled out, one long word. And then I currently have a practice in Whitefish Bay, Wisconsin, just north of downtown Milwaukee. And we're opening a second location in Franklin this summer.
That's so exciting.
So we'll be serving both the North Shore and the South Shore.
I love that. And we'll put the links to her Instagram and her website in our show notes. Thank you so much for being here and joining us. Let us know what questions you have and what you want to hear from us next time we meet. Have a great day, and thanks for joining us on No One Told Me. Okay, bye.
Thanks for tuning in to the Untethered Airway podcast.
If today's episode helped you see things differently,
Please share it with someone who would benefit from hearing this. And don't forget to subscribe.
want to learn more about airway health or connect with our team?
Please visit our website, untetherediairwayhealthcenter.com, or follow us on Instagram @untetheredairway.
Until next time, bye.